Welcome to Kahoma Community College's Center for Excellence in Teaching and Learning podcast. I am your host, Dr. Ouida McAfee, and our guest today is Mrs. Carissa Wells-Bone. Welcome, Mrs. Wells-Bone.
Hi, thank you for having me. I'm very excited to join you today.
Great, we're excited to have you. Our topic today is psychological health and safety for professionals in higher education. Psychological health and safety for professionals in higher education. So before we get started, will you tell us a little bit about you, Mrs. Wells-Bone?
Absolutely. So, my name is Carissa Wells-Bone, and I'm a native of Mississippi. Now, I grew up not just in Mississippi, but in rural Mississippi in a town called Hamilton. So, it was very far removed from, I guess you could say, any metropolitan area. But I kind of, in my mind, always had a vision that what I wanted to do with my life would impact from what I call the country greens to the city streams or city streets. So I've always had a vision to impact, empower, inspire, and motivate individuals to be their best selves. And I can remember that literally being a little girl in rural Mississippi, looking out at the pasture behind my grandparents' house and the gardens in front of it, and knowing that while there was a bigger space, I wanted to impact and empower the immediate space that I was in, which led me to eventually the space of mental health. So I really loved biology, but I was drawn to psychological health. And as I grew to know more about the space of psychological health, I realized that the area that seemed to be missing was prevention. So I do have a degree in psychology. I have a master's degree in psychology. I've worked extensively with the military. My area of expertise is with children and families, with military. And then in 2010, I went into the business world as a consultant. And my life has married two of my great loves professionally and personally, that is empowering people to be their best selves by caring for their mental health and doing so proactively. So as a consultant, I was brought in to support the military and finding the root cause of the increased suicides that happened after the Iraq war. And what we found that while we were targeting substance abuse and prevention, the root cause was largely trauma, and not just trauma that occurred in the war, but that the individuals were not necessarily proactively prepared to manage what they would be exposed to. And after my work there for several years, I went to work in a corporate environment, and at scale and at pace across corporate America, especially in the high demand areas, we are finding that professionals are struggling to keep up with demands, not only of a 9 to 5 or 9 to 9 in corporate America, but that life occurs at the same time. I found this same thing to be true with medical professionals and also those in higher ed with what we call the compound stressors they face. So my mission in life is to help people proactively and preventatively manage their psychological health. And today we're really leaning into what that looks like for professionals in higher ed and how we can provide them with the support, information, and awareness to manage their psychological health preventatively.
Excellent, thank you. So we'll jump right in. Let's talk about stress inoculation. What is stress inoculation?
So I think an easy way for me to explain this is to liken it to the inoculation that we get for common childhood illnesses. We have vaccines, and don't get me wrong, I know those are controversial in some spaces, but then the foundation of this theoretical principle is that, again, we're very proactive. So we are essentially identifying what stressors are present in a particular environment, profession in this case. And then once we understand those stressors, the thing that elicit or bring about stress, we provide strategies and techniques to identify those in whatever environment they might present, and then also identify what we can do to mitigate or lessen, minimize the impact of those stressors if not eradicate or completely rid ourselves of the negative stress impact the stressors might have.
What's an example?
So one example you might think of is as a professor, for example, we know that when we have certain times of year, we find that there are more stressors present. So let's say when it's the end of year, when it's exam time, exam periods, we know that there's going to be a heightened demand from students. You have to grade exams. There's also a change in scheduling. So realizing that's a key time of increased stressors, we know that those three stressors exist. So what can we do to mitigate that? Number one, for me personally, is the change in schedule. For me personally, that's hard for me because I'm a very regimented person. So what I would do was I would look at, okay, here is the schedule during exam period. What do I need to shift or move personally to accommodate these changes in professional demands around my time? And so I can do that up to 3 months in advance, because we know at the beginning of the year or the semester when that exam period will fall. Number two is, after I make those adjustments with my schedule, I will look at, okay, what are the demands as far as when I'm in the classroom? How can I use that time in the classroom to take care of the extra requirements that are on me at this time? So it's about planning and preparation. How can I maybe have office hours? And during those office hours, I'm going to intentionally schedule certain students to come in because I know these students are going to need me. So proactively, it's October. I'm going to say, and I'm making this up, I don't know exactly what the timelines look like for you, but whatever, once I've identified my students who are at higher need, I'm going to proactively say, these are my office hours, and I want you to come in here during these times. Instead of at the last minute, I'm overwhelmed during office hours. That will then allow me to create space within certain office hours on specific days during exam time to maybe work on grades, or it will allow me to work on other administrative tasks that I have. So it's all about proactively identifying those stressors and then managing them, planning and preparing. Stress inoculation, that's one example, because you won't be taken by surprise so much, because we know we'll have unpredictable elements, but we have created what we call protective factors around those areas that we know are a risk for added stress.
So that leads us into a conversation about cognitive behavioral techniques for managing stress. Let's talk about that.
Absolutely. Again, I will slow down here because cognitive behavioral techniques actually feeds into stress inoculation. It absolutely can, because cognitive behavioral techniques speak to how we are thinking and behaving, how we are thinking, how we are acting, what we are focused on in our thoughts, and how that impacts what we do. It also impacts how we feel, which goes back to the stress. So if you're thinking about, as an educator in higher education, really the cycles are very important for us to pay attention to. And I think whereas that tends to feel overwhelming at times, it's also a great and tremendous opportunity when we step back objectively to look at the big picture, and then we sort of break it down into chunks of what we can manage. So at certain points throughout the academic calendar, we have peaks and we have valleys of activity. So how we are perceiving, again, cognitively thinking about these activities can be overwhelming if we are looking at it as all or nothing. From a cognitive behavioral perspective, my high level recommendation is to step back, zoom out, look at the chunks of your academic calendar. Identify which of those you really enjoy. What are the things that are most enjoyable? When you complete them, you feel a sense of accomplishment. You feel these are are the things that I live for. This is why I went into this business. Take those things and space activities intentionally across your academic year to work on those particular items, to invest time, effort, and energy into those. So as you have prepared yourself to not only create space for what is necessary and required, but also for those things that are desired. And that's going to look differently for everyone. But what it will do is cause us to frame our work in a way that is inspiring and motivating. Because when we're talking about our cognition, it's about how we're thinking about the things that we're doing for the purposes of this conversation. And with that example, we are going to nestle things that we enjoy and we're looking forward to somewhere in the middle of those things that can feel taxing or overwhelming. So if I enjoy writing and I want to complete a certain number of articles within a semester or submit to a certain number of journals, then I'm going to create space every week to write just a little bit each week. Or I want to have this article complete within 4 to 6 weeks or 1 month. Every 3 months, I want to submit to a journal. Figure out what that looks like for you. I don't know, but cognitively, it will cause you to frame up and shape up everything else around those things that you enjoy, giving you a sense of accomplishment. And you will then be able to build out patterns, actions, activities, i.e., a calendar that will drive your behaviors to get you to where you want to go. And every bit of it will be intentional and directed by yourself. And I can already hear the academics in the room and saying, no, 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 no. What drives our agenda is, the university or the college agenda. I hear you saying that. But within that, what can you take ownership of? Because going back to the cognitive behavioral techniques, when we identify what we can own and we action those, that's when our behaviors are driven toward accomplishing those things, which, by the way, when you take these actions and you feel good, you will just inherently help the institution to look good, right?
Mm-hmm. Okay, so let's talk about preventative psychological health practices for high stress professions. Preventative
Yes.
psychological health practices for high stress professions.
Again, going back to stress inoculation, cognitive behavioral, what works for you? What works for you? As professionals, we often, especially in such publicly lauded professions as academics, we may have chosen to go into these fields for reasons of public service. I want to help. I want to make a difference. Or it just feels right. Or I'm going into it for the money. Or it's prestigious. I ask first and foremost that we take the time as professionals to write down why we started all of this to begin with. Think back to that, I don't know, the 20-year-old, the 22-year-old, the 18-year-old you, or maybe 30-year-old, whenever you entered this particular field. List 3 to 5 motivating factors. Why are you doing this? That's the first thing I want each professional to do. So, what initiated this action? Number 1, 3 things. Number 2 is, what are the sustaining actions? So I went into the field of psychology because I saw a need for help in the space, right, of mental health, wanting to inspire, motivate, encourage. It all begins with the mind. And where I was growing up, there was certainly a lack of resources, but not just, like I said, not just in the grassy knolls, but also on my, if you will, the city strolls. There is, and definitely was, a lack of mental health care providers. And there continues to be, by the way. And what's sustaining me today? Largely because I see the increased need, but also my mission is prevention. And we're just not doing that at all. So what's sustaining me today? Quite frankly, to make a living, right? I need the income, but the passion that drives it is my vision and my mantle to shift the conversation around psychological health to prevention as opposed to reactive. So for you as a professional, what initiated and inspired you getting into this business, and what's keeping you here? And the third thing is, how are you keeping as you are doing? So what are you doing to keep yourself well as you're doing this work? And when we stop to think about intentional practices to be well, it's hard to often come up with those because we think about first, well, what am I doing? What am I doing? What am I doing? Well, what are you doing to care for your being? I know that sounds like I'm running in circles there, but that's key. As professionals, we're so accustomed to producing, to outcomes, to delivering, to giving even. And I know you've heard this before, but it's really hard to pour out of an empty vessel. And that's where we found ourselves. We are dealing with post-pandemic stress, and especially in the area of higher education. Not only are you navigating this world within your own space and professionally so, but you take on, whether we like it or not, many of the implications of the experiences of those you're educating. So as it relates to the professional that I'm speaking to today, and that being the professionals in higher education, I ask you to literally, even as you're listening to this podcast today, to stop and think about how you even create distance between the work that you do professionally and the life that you live personally. I can say with great conviction that I have yet to meet someone working in higher education who consistently keeps that distance without the help of a professional. Because you're thinking about what's next. You're thinking about that student. You're thinking about, how do I advance my career? And yet that's always including some aspect of delivering to your students, delivering to the university, delivering to whoever the governing body is of your particular license. There's always a mindset of delivering and producing and providing, as opposed to abiding in a space that is healthy and helpful for yourself. So lots of words there, but as you are listening to this podcast today, the one takeaway I want you to be clear on is how you leave this conversation to continue conversations with yourself around creating distance and getting super clear on what brought you into this work, what's keeping you into this work, and how you will sustain yourself moving forward, being your best self in order to do your best work.
We are talking to Mrs. Carissa Wells Bone today about psychological health and safety for professionals in higher education. Mrs. Wells Bone, what are your final thoughts that you would like to leave with us today?
Dr. McAfee, thank you for having me, and thank you for that question. It's really one word, and that word is prevention. We are in a society where we are hearing about reactive responses to what we know is one of the most prolific problems we're facing, and that is a mental health care crisis, which is, by the way, why I'm very keen to refer to what I do is psychological healthcare and safety. So the work that I do is prevention as it relates to psychological health and safety, because we're reacting. But if we can become proactive with our psychological health, as we are, and we are educated to do with our physical health, we can avoid many of the tragedies that we've seen recently. Because when we are well versed in any subject, and you as educators know this, when we are educated, we are informed, and we use that information to make better, smarter choices earlier and more consistently. So it's not just about me understanding my psychological health and well-being, the parameters around observing what that looks like for me. But when I know what that looks like in general, I can also have awareness around the person next to me, and specifically in higher ed as it relates to the student body, the people you encounter day in and day out. Once we understand what to look for proactively in ourselves, we will inherently have that visibility for others. So that's what I leave you with today, is to intentionally, proactively learn about your psychological health. And when it's your psychological health, there are basic measures of psychological health and safety that we can read about. I've talked about a few things you can do today just to take immediate action. And if you'd like to know more, you can always reach out to me personally, and we can set up time to discuss one-on-one or as a group, so that we can be proactive and create an environment that is proactively educating, informing, and moving to support our psychological health.
Mrs. Wellsbone, how do people contact you?
You can reach out to me via phone. My phone number is 501-952-8869. You can text me there as well.
Thank you for being with us today, Mrs. Carissa Wellsbone.
Thank you for having me.